This is Dr. Parsa Mohebi, Medical Director of U.S. Hair Restoration. Thank you, Stephen, for the nice and warm introduction. Today I'm going to be talking about reframing the face with hair transplant surgery. Reframing of the face is one of the most important concepts for hair transplant surgeons or cosmetic doctors who are performing hair restoration surgery. We know by experience and by knowledge that was passed on to us that a good-looking face is not unrelated to proportional face. So basically, to create or to give people a proportional face, we are restoring their beauty of the face. Hair transplant in many situations tries to restore the balance of face. It's seen in men with male pattern hair loss, and also in women who might need to rebalance or restore the balance of their face. This is a patient of U.S. hair restoration that with a hair transplant. As you could see, he was class 6 of baldness. He was completely bald on top, and now he has full head of hair. But more than anything, you see that his face is looking younger after hair transplant. So that has to do obviously with restoration of hair and elimination of the baldness, but also that proportionalness of the face is very helpful in this situation. This is the same patient again. You see 1/3, 1/3, 1/3. Basically, the distance between the nose to the chin should be the same as tip of the nose to the area between two eyebrows, and from eyebrows to the hairline should be the same, almost the same. So when you see people are balding, the first thing that is important to notice is that the upper third is becoming more than 1/3. So that's changing the balance. That hair restoration can easily restore that. Facial balance is important in several situations. One is in reconstructive procedures in men with male pattern baldness, as we discussed in the previous example. Women with the hair loss that have recession of hairline too might use that rejuvenation effect of hair restoration. Also in cosmetic cases that people don't have really baldness but they have congenitally elevated hairline, that could happen in men or women. I have done many men who did not really have hair loss but they congenitally had elevated hairline, and by doing hair restoration they recreated or reframed their face to look younger and more handsome. In some men or women, the temple areas might be receded. That's pretty common in men with advanced stages of hair restoration, advanced stages of male pattern hair loss. Also, the other indications for doing feminine hairline design is in women who are doing cosmetic procedures and creating that feminine hairline that they deserve. Also, some men or women may lose their sideburn, or they may never have a sideburn, and that could be restored with a hair restoration procedure. Elevated hairline that could be seen in many women, or the hairline that is flat or even receded on the corners. As you can see in this lady, that her hairline is more of a male type hairline, and she doesn't have that feminine look to her hairline. So this is my design right before hair restoration. I give some options to these patients. Bringing the hairline is obviously the most important thing, but also on the sides, that hairline could be kind of more flat or less curviness toward the actually bottom, but people could choose to have a more aggressive hairline and make those humps that make the makes the face of a woman more feminine. You can see it in different angles. And the other situation is temple recession that could be restored by hair transplant surgery. In those cases, we can see more often in men who are having male pattern baldness, and they're experiencing the earliest stages of male pattern hair loss. When we do microscopic evaluation, we see the temple areas are having significant miniaturization or signs of future hair loss. So in addition to restoring the hairline, we have to restore the temples to prevent future appearance of hair loss in those areas. Sideburns are important in both men and women. This is a picture of a lady who had a facelift procedure, and she lost her temples because of that. Facelift sometimes may be complicated by loss of hairline on the temple area and loss of the whole temples or sideburns. In this case, this sideburn is designed to be restored in its natural shape that can help patient to look more rejuvenile. Facial hairline or facial hair could be restored to frame the face in people who choose to keep them or style them. Starting from temple hair restoration, could be used in different situations. Receded hairline in advanced stages of male pattern baldness, as we discussed. Most people who lose everything on top and crown, they usually have some degrees of recession of temples, and restoring the hair on top is not usually enough if we don't do the restoration of temples and sideburns. Also, in people that are not having that horizontal balance of face, in those cases they may not even have any signs of hair loss, but by bringing the temples forward, we can make the face look more balanced and more handsome. Also, premature facial aging that could be seen in some people because of trauma or because of some congenital situations, that could be improved with hair restoration procedure. This is a gentleman who had a hair transplant procedure. As I said, he has advanced hair loss. The whole top and crown is gone. He's class 7 of hair loss. But we didn't just stop at bringing the hairline lower. We helped the temples too. The temple is almost flat now after surgery. He has a angled hairline that makes the face a little bit more younger. This other gentleman, he has a earlier stages of male pattern baldness, but more than anything else, he has a face that we usually call a heart-shaped face. That, as you can see, the chin is very narrow and the forehead is pretty wide, and that makes the face look like a heart or a lamp. So in these situations, it's a very important thing to restore the hairline to reduce that contrast between the size of the forehead to the chin. And as you can see here, that's the same patient right after, like 10 days after procedure. In addition to the top, that the front that has been restored, the temples has been brought forward to make the face more refreshed and more young, to become more young. This is a temple hair restoration is in a gentleman who has premature facial aging because of a condition called turban alopecia that happen in many Indian people who are using turbans, very tightly used turban for a long time, and that causes traction alopecia and losing hair on the front and on the temple. This gentleman, this is the new design for his hairline. By doing a hair restoration, bringing the temple forward, he can get his balance of the face back. Facial framing master planning include restoration of balding areas. These are the 4 main items that are needed in most patients, or at least in some patients who are doing the facial reframing or facial framing. Obviously, the balding areas are important to be restored. That's the first priority in most patients. We also do rejuvenation of the face by making temple points and bringing temples forward in patients who are losing them, which is in my practice includes actually majority of patients who have high stages of hair loss. We also have procedures to reduce the donor-recipient contrast. Basically, people who have temples in its perfect shape, when we do restoration on the top, we have to remove hair from temples and put on the top and on the other areas that are balding, so that 100% density on the sides are not contrasting with the balding top. So that will help people to be keeping their balance. And also at the end, constructing the facial balance, as we discussed, both vertically and horizontally, makes the face of a patient look more rejuvenile.